Hi, I'm Elinor Silverstein, and I am here talking with Dr. Michael Harrington from Pasadena.
Hello.
And welcome, Michael. Welcome. Thank you so much for coming to this. And you are a researcher a neurologist and researcher that works with looking at what is happening measurably in the cerebral spinal fluid and measuring the brain and working with people who suffer from migraines and, as we say in this country and everywhere else, migraines. And thank you for correcting me. I appreciate that. And also for doing research in Alzheimer's. And also, you were one of the lead researchers in working with finding Creutzfeldt-Jakob disease. And for people like you, we are amazingly grateful. And what I love on your website is that it says, and that you are also open-minded in having conversations with people who are in the alternative healthcare field. And for this, I thank you, because here I am in the alternative healthcare field as a Feldenkrais practitioner and having some thoughts. And you, the researcher, and you've actually worked with measuring oxytocin in your lab, yes?
We've just recently started working with that. It's a neuropeptide that is very similar to a lot of neuropeptides those are little proteins, strings of amino acids. So we're looking forward to looking at it more actively.
So this is going to be the incredible piece, because we're going to work together and find the way to measure oxytocin levels in people before and after they've had a Feldenkrais lesson, most likely the awareness through movement part of the lesson. And my curiosity has always been, when we see people after a Feldenkrais lesson, their ability to make eye contact and connecting and sensing and feeling everyone in the room is so different than before they start the lesson. And when I teach awareness through movement lessons for people with autism and who are on the spectrum, with Asperger's and autism, when they leave, or even when they finish the lesson, their ability to make eye contact and be present with someone else without averting the gaze in soft eyes and saying things like, "Mom, I'd like to go grocery shopping. I'd like to go for ice cream now," and sit and just watch people. Their own self-recognition is so amazing. And so for me to be able to connect with you, to help us find this, is a big thing, because, and correct me if I'm wrong, but one way that we can measure vagal tone is by measuring oxytocin levels. And this is a help in our health, not just our physical healing, but in our psycho-emotional healing. Yes?
I agree. I mean, I think, so you're an expert practitioner and as you've just described, and we're interested in trying to find objective measures and mechanisms of our behaviors that underlie the behaviors, because, you know, as you'd like to have some better understanding, better proof of what works, so that it can help guide better treatment. And I mean, oxytocin is a really interesting molecule. It's being trialed just now. You may not be aware of this, for migraine. And there's a very active study that was done recently in South America, and it's being developed. This is by administering oxytocin to help people with migraine. I don't know the details.
Are they breathing it in? Are they doing the spray?
It's nasal administration, yes. But I think, you know, what is the placebo effect? You know, and on one level, who cares what the mechanism behind a placebo? I do care. But when you get something that helps people and it doesn't harm them, there are no adverse effects. This is a very important treatment. And so getting some understanding of that is a big interest of ours. In migraine, for instance, there's an enormous placebo effect. It's much greater than in the treatment of other conditions. So it would be great to understand if we could learn how that's achieved, more people could benefit from it.
Wow. So we're talking more than just people being able to connect, but people who are suffering such debilitating diseases
Yes,
from that, as migraines, which have caused so many people to have to stop even being able to do the most incredible work that they do.
that's right. I mean, it's the disability caused by chronic daily headaches, for instance. There's over 3 million Americans suffer from chronic daily headaches. Now, I can't imagine what that would be like. And treatment's really, really bad, close to inadequate for those people.
Right, right. I've seen people go to neurologists and have the neurologist tell them basically they're crazy. The neurologist has done everything, and then the neurologist blames the person.
I know this so-called somatization. And what's very interesting, there's some arguments where we should know that that's actually not the case. Firstly, I've learned long ago, from when I was even younger than I am now in Scotland and training, that just believe what people tell you, because they don't have any great reason to lie. I mean, the obvious malingerer Munchausen syndrome, they're so obviously abnormal, but people are not really justified in lying about this. But here's a thing where emergency departments and some healthcare professionals think that migraineurs going to the emergency department, which is the worst place for them to go because it's noisy, loud, they'll wait around forever, probably to be given a narcotic just to get rid of them, and that's the worst thing they could get for migraine. But anyway, they're considered to be drug seekers, drug abusers.
Yep, I've
And
heard that. It's
what's
terrible.
interesting is the people who are those drug seekers, and that's again considered by most of us to be a disorder by itself, are the people with other pain conditions. Headache sufferers do not go seeking drugs, as do people with back pain, joint pain, leg pain, ankle pains. So I think the evidence is overwhelming that these people should not be dismissed as being the sick ones. It's just we don't have treatments for them, and we urgently need efforts to change that.
Yeah. Yeah. Wow. Thank you so much for your studies and research that you're doing. And thank you for taking me maybe a little under your wing to work with studying, measuring the oxytocin. My hope in this is, I never thought about it in terms of people with migraines, but my hope is that when we can give people around the world the ability to do something as easy, as simple as these gentle movement lessons, it's not only cheap, it's free. They're doing it themselves for themselves. And yes, they can go to a class for $12, $15, but they can do this for themselves and make those shifts for themselves. And if that's the case, and that we go around in our society with that ability to connect and sense other people, what a better world we can make this place in such an easier way as one piece.
Without adverse effects, exactly, which is the big problem with any medication.
Yeah, I always say that there are side effects to the Feldenkrais method. Is you might feel better, move easier, have more coordination, and
Oh dear, oh dear.
I'm so sorry. So thank you for giving me the peace after all these years in my practice to be able to connect with you, that we can work together to create this possibility. And again, as I've said before, I hope that we get to have many more talks in between us working with our study together to share your knowledge and have these conversations to enrich other people's lives.
Look forward to it. Thanks so much, Elinor. It's a pleasure.
Thank you so much, Michael. Bye.
Goodbye.